Have you ever walked out of a medical appointment feeling more confused than reassured? Maybe you went in for a routine test. Something your neighbor said you should do, something you saw advertised on television, something that sounded responsible and smart. And instead of peace of mind, you left with anxiety, a suspicious number, a shadow on a scan, a follow-up procedure, another bill, another sleepless night. After 60, we're told that more testing means better care. More screening means we're being proactive. More checkups mean we're being responsible. But what if I told you that some health checkups, especially after 60, may actually cause more harm than help? I know that sounds uncomfortable. It almost feels wrong to say it. Because for decades, we've been conditioned to believe that catching everything early is always best. And while prevention is powerful, overtesting is real, overtreatment is real, and the emotional toll of false alarms is very real. Today, I want to gently walk you through 5 health checkups that many adults over 60 may not need routinely, and in some cases should carefully reconsider. Not because doctors are careless, not because medicine is broken, but because your body changes with age, risk changes with age, and sometimes the benefit of a test becomes smaller than the harm it might cause. We'll talk about unnecessary radiation exposure. We'll talk about false positives that lead to invasive procedures. We'll talk about overdiagnosis, finding something that never would have harmed you, but once discovered, sets off a cascade of fear and treatment. And most importantly, I'll explain how to know when a test makes sense for you and when it might not. Because here's the truth that doesn't get said enough. Good healthcare after 60 is not about doing everything. It's about doing the right things. If you stay with me until the end of this video, you'll understand why some routine screenings are no longer beneficial after a certain age. How just to be safe can sometimes create unnecessary danger. What questions to ask your doctor before agreeing to a test, and how to protect your health without falling into the trap of overtesting. This is not about fear. It's about empowerment. It's about wisdom. It's about understanding that aging well means being thoughtful, not reactive. And the 5th checkup I'll mention today may surprise you the most, because it's one that millions of seniors still schedule every single year, even when the evidence no longer supports it. So take a deep breath with me. This conversation is not about avoiding care. It's about choosing care wisely. Let's begin. The first health checkup many people over 60 should carefully reconsider is routine full-body CT scanning for peace of mind. Now I know the appeal. The idea sounds comforting. One scan, head to toe. Check everything. Rule everything out. Walk away feeling safe. But here's what most people don't realize. A full-body CT scan exposes you to a significant dose of radiation. In fact, one scan can equal the radiation of hundreds of chest X-rays. And while one scan may not seem like a big deal, repeated exposure over time increases cancer risk, especially when done without a clear medical reason. Even more concerning? These scans often find incidentalomas, small harmless nodules, tiny cysts, benign shadows, things that would never cause symptoms in your lifetime. But once they're found, they can't be unseen. Suddenly you need another scan, then maybe a biopsy, then maybe surgery. All for something that was never dangerous in the first place. I've seen patients lose months of peace over a spot that turned out to be nothing. I've seen complications from biopsies that never needed to happen. Screening tests are powerful tools when used appropriately. But without symptoms or risk factors, full-body CT scans are rarely recommended by major medical organizations for healthy seniors. And yet they're marketed aggressively. So here's a question I always encourage my patients to ask. Will this test change what we do next? If the answer is no, then we need to reconsider why we're doing it. And this is just the beginning. Because the second checkup on our list is something millions of women over 60 continue every year, even when guidelines suggest it may no longer be necessary depending on their history. We're going to talk about that next. And what I'm about to explain may relieve more anxiety than you expect. As we continue, I want you to remember something important. This conversation is not about telling you to stop caring about your health. It's about understanding when a test truly protects you and when it quietly puts you at risk without adding real benefit. The second health checkup many adults over 60 should thoughtfully reconsider is routine annual cancer screening without considering personal history, overall health, and life expectancy. Let me explain this gently. Cancer screening was designed to find aggressive disease early in people who are likely to live long enough to benefit from treatment. That's the key point many people never hear. As we age, the biology of many cancers changes. Some grow so slowly that they would never cause harm during a person's natural lifespan. Yet once detected, they often lead to surgery, radiation, or medications that can seriously affect quality of life. This is especially true for certain routine screenings that continue automatically, year after year, simply because that's what we've always done. Here's where our overdiagnosis comes in. Overdiagnosis means finding a disease that would never have caused symptoms or shortened life. But once the label is applied, the emotional weight is heavy, fear takes over. Treatment follows. Side effects begin. And sometimes the treatment becomes more dangerous than the disease itself. I remember a patient in her late 60s. She felt healthy. She walked every morning. She had no symptoms at all. A routine screening found a tiny abnormality that led to more testing, then a biopsy, then surgery. The abnormality turned out to be extremely slow-growing, something that would never have harmed her. But the surgery left her with chronic pain she still lives with today. This is not an isolated story. Screening should always be individualized after 60. It should be based on personal risk factors, family history, prior test results, and most importantly, whether finding something would actually improve both length and quality of life. Another common misconception is that early detection always saves lives. Sometimes it does. And sometimes it only increases years lived with worry, procedures, and side effects without extending life at all. That's why thoughtful doctors now ask different questions. Not just can we find it, but should we look for it? And what happens if we do? The third health checkup many seniors should reconsider is frequent bone density testing without clear changes in risk or treatment plans. Bone scans are valuable tools when used properly. They help identify osteoporosis and fracture risk. But repeating them too often, especially when results won't change management, can create unnecessary anxiety and lead to overtreatment. Bone density changes slowly. In many cases, repeating the test too frequently doesn't provide new information. Yet patients see small numerical changes and panic. Medications may be started earlier than needed, sometimes causing digestive issues, muscle pain, or rare but serious complications. Again, the key question is simple. Will this test change what we do? If the answer is no, it may be wiser to focus on strength, balance, nutrition, and fall prevention, things that truly protect bones every day. And this brings us to something deeper than any single test. After 60, medicine works best when it shifts from fear-driven testing to function-focused care. How well can you move? How well can you sleep? How steady is your balance? How strong is your heart during daily activity? Tests should support living well, not distract from it. In the next part, I'm going to walk you through practical, reassuring guidance. What to do instead of unnecessary testing. How to have better conversations with your doctor. Daily habits that protect your health far more than another scan or blood draw ever could. And I'll also explain one very common blood test that many seniors get just because, even though it often leads to confusion rather than clarity. Stay with me. Now, let's talk about what truly helps, because avoiding unnecessary tests does not mean doing nothing. In fact, it means doing the things that matter most. The fourth health checkup many adults over 60 should reconsider is frequent. Broad blood testing done without symptoms or a clear purpose. I often see patients who come in with pages of lab results. Numbers highlighted, arrows pointing up and down. Words like borderline and slightly abnormal, and instead of clarity, they feel overwhelmed and frightened. Here's the truth many people don't realize. As we age, normal ranges change. Lab values fluctuate naturally. A number slightly outside the reference range does not automatically mean disease. But once an abnormal value appears on paper, it's hard to ignore. That can lead to repeat testing, then medications, then side effects. All triggered by a number, not a symptom. I've seen healthy seniors placed on medications for almost high values that never caused harm, only to develop dizziness, fatigue, or falls from treatment they never truly needed. Blood tests are powerful when they answer a specific question. They're less helpful when ordered just to check everything. A better approach after 60 is targeted testing. Testing based on how you feel, based on meaningful changes, based on whether the result will guide a decision. Instead of chasing numbers, we should be listening to the body. Are you feeling weaker than before? More tired? Short of breath? Losing weight without trying? Those are reasons to investigate. But testing without context often creates more noise than insight. And this brings us to the fifth and final checkup, the one that surprises many people. Routine heart testing in people without symptoms. Stress tests, advanced cardiac scans, and imaging done simply because someone is over 60 can sometimes open doors that don't need opening. In people without chest pain, shortness of breath, or functional decline, these tests often find minor abnormalities that never progress. But once discovered, they can lead to invasive procedures that carry real risks. I've seen patients go from feeling fine to living with stents, medications, and anxiety, all from a test that wasn't prompted by symptoms. Heart health after 60 is better protected by daily movement, blood pressure awareness, good sleep, stress reduction, and meaningful connection, not by routine imaging without reason. So what should you do instead? The most powerful habit you can build is conversation. Before any test, ask your doctor 3 simple questions. What is this test looking for? What happens if it finds something? What happens if we don't do it? A good doctor will welcome those questions. Focus your energy on habits that give returns every single day. Gentle strength training to protect muscles and bones. Walking to support circulation and heart health. Eating real, nourishing foods. Sleeping deeply, staying socially connected. Managing stress. These are not small things. These are medicine. Avoid the common mistake of thinking that more testing equals better care. Wisdom is knowing when less is more. In this final part, I want to bring everything together, not with fear, but with reassurance and hope. Because aging does not mean fragility, it means experience, it means discernment. It means choosing what truly serves you. If there's one message I hope stays with you long after this video ends, it's this. Your health after 60 is not defined by how many tests you take, but by how well you live each day. You are not behind. You are not neglecting yourself by asking thoughtful questions. You are not giving up by choosing fewer tests. In many cases, you are choosing wisdom. I've sat with patients who were exhausted, not from illness, but from the constant cycle of appointments, scans, and worry. And I've also seen the transformation that happens when someone realizes they don't need to chase every number, every shadow, every what if. They sleep better, they move more freely. They stop living in fear of the next result. Remember the 5 ideas we talked about today. Full body scans without symptoms can create harm through radiation and false alarms. Routine cancer screening should be individualized, not automatic. Bone density tests don't need to be repeated too often when nothing has changed. Broad blood panels can confuse more than clarify when there's no purpose behind them. And heart testing without symptoms can lead down paths that were never necessary. None of this means avoiding doctors. It means partnering with them. It means shifting from fear-based medicine to function-based care. Ask questions. Speak up. You are allowed to understand. You are allowed to say, let's think about this. Good healthcare is a conversation, not a conveyor belt. And please remember this, your body is not broken just because it's aging. Aging is not a disease. It is a natural process that can be lived with strength, dignity, and peace when we stop fighting it with unnecessary interventions. Focus on what you can do today. Move your body gently. Eat foods that nourish you. Stay curious. Stay connected. Protect your sleep. Protect your joy. These are the things that no scan can measure, but every healthy life depends on. If this message helped you feel calmer, more confident, or more informed, take a moment to support this channel. Gently tap the like button so this video can reach others who may be quietly worrying like you once did. Subscribe if you want more honest, practical guidance for living well after 60. And I'd love to hear from you in the comments. Tell me, what health checkup have you always felt unsure about? You're not alone in this journey. And you don't need to do more. You just need to do what truly matters. Thank you for spending this time with me.